Hello, Assalamu alaikum. My name is Kimberly Julian and my roll number is BP1650106. I'm a student of 5th Prof Morning and the drug that has been assigned to me for this presentation is clomipramine under the heading of Essential Drug Knowledge for Pharmacists. So let's begin. Uh, in this presentation, we're basically going to discuss the main indications of clomipramine along with its side effects. Further on, moving to contraindications, its dosage, availability, and use, and then its use in a clinical case setting. So, before diving into the drug, let's go on towards its introduction and what is basically its rational use. Clomipramine is a tricyclic antidepressant that acts by reducing the reuptake of norepinephrine and serotonin in central nervous system. What this does is basically it enhances the effects of these neurotransmitters and binds to different receptors which are responsible for various side effects that come on the use of this drug. Basically, it's an oral agent and is used for the treatment of obsessive compulsive disorder. So, what are its main indications? Obsessive compulsive disorder is basically a disorder in which the person has obsessive kinds of thoughts and to minimize the frustration caused by such thoughts, he has this compulsion to perform certain tasks and the need to perform certain activities that might make him feel better. So, when it turns to a state that is actually inhibiting his life or making it worse, it comes under the heading of a disorder, and we call it obsessive compulsive disorder or OCD for short. Other than that, clomipramine is also used in panic disorder and major depressive disorder. In panic disorder, it is used to minimize the occurrence of attacks, whereas in major depressive disorder or depression, it is used to elevate patient mood. But its main indication is still OCD. The side effects caused by clomipramine vary from CNS effects to various other effects, including GI effects, vision effects, and cardiac effects. Due to its effects on the nervous system, it may cause dizziness, drowsiness, and its effects on the GI include nausea, vomiting, and appetite changes, GI distress. In vision effects, it might cause the vision to blur and it causes mid-traces on the. When we start therapy with clomipramine, sometimes there is an occurrence that the anxiety may worsen first instead of getting better. And it is a common side effect. However, if it does not subside, we may need to change the dose or we may need to go to other alternatives as this person might not be able to use clomipramine. This is why a bit of anxiety is normal at the start of therapy, but if it persists, it needs medical attention. Other side effects commonly include fatigue, tremors, headaches, and weakness, etc., etc. So now moving on to its contraindications. Known hypersensitivity to clomipramine is by cross sensitivity or by the use of any other tricyclic antidepressants. We cannot give more than one antidepressant if we do not know how they contraindicate with each other. Other than that, as we have seen in the previous slide, this drug causes a lot of cardiovascular issues. So giving it in a person that already has some congenital heart defects or a case history of myocardial infarction is contraindicated. Other than that, it may affect worse in patients of mania and with severe liver disease. It must not be taken with grapefruit juice or any other food substance that has enzyme inhibiting qualities because it reacts with the enzyme and then the bioavailability of the drug is severely affected. Its known drug interactions are with anticholinergics, higher BP medications, thyroid supplements, drugs that can cause bleeding, MAO inhibitors, like we have previously discussed, that we cannot give more antidepressants that are um, that are known to have contraindicating effects. Other than that, drugs that may affect the heart rhythm because clomipramine seriously affects the cardiovascular system, or any other drug that affects the removal of clomipramine from the body. For examples of drugs are given in this slide, like anticholinergics include atropine, belladonna. Drugs for high blood pressure include clonidine. Drugs that cause bleeding, like anticoagulants, warfarin, heparin, MAO inhibitors like isocarboxazide and linezolid, and serotonin. And the drugs that increase serotonin may cause toxicity, like MDMA and ecstasy. Other medications that affect the removal of clomipramine from the body include barbiturates, and drugs that prolong the QT interval include erythromycin and macrolide antibiotics, quinidine, primizoid, and a lot of other medications. Moving on to its dosage and use. It is available as capsule in various potencies, including 25 milligram, 50 milligram, and 70 milligram. However, dosage starts in adults from 25 milligram and it's gradually increased to 100 milligram per day, divided with meals over 2 weeks. It is not, its safety and efficacy is not established in children under 10 years of age, so it is not recommended for pediatric use, and it is not recommended for use in pregnancy as well. In geriatric considerations, it has the same dosage, however, monitoring is required. The available brands for clomipramine are Enafril, Clomiphenil, and Clomexit. From this table, we can see its retail price and its trade price. Pharmacoeconomic suggestion hence then becomes that Enafril is the most commonly used one, and its efficacy is established and seen. It is mostly commonly used in the hospital settings. If Enafril is not available, then we can move to Clomexit. As we can see, it is the other option that is available for people with all kinds of finances, and if that is also not available, we can move on to clomiphenil. Other brands are also available, but from the start we can see that they have a bit high price and may not be suitable for people who cannot afford it. If there is a side reaction or if the person's body is not getting suited to the clomipramine treatment, we can also substitute with other tricyclic antidepressants such as amitriptyline or lofipramine. If we are not wanting to use the tricyclic antidepressants due to excessive side effects, or for example, if cannot administer to a person with cardiovascular defects, we can also move on to SSRI antidepressants in people with OCD. Examples of the SSRI antidepressants that can be used include fluoxetine, paroxetine, duloxetine, and so on. Sometimes it is necessary to provide counseling, and in other cases, you may even not need to prescribe any medication. So, that is why non pharmacological management like counseling is necessary. If the counseling or talking therapy is actually effective, you may not need to go towards any sort of antidepressant, including tricyclic or SSRI. Uh, Till here, we have discussed its rational use, basically how it is supposed to be administered, what kind of brands are available, what are its main indications. Now we will discuss its irrational use or how it is wrongly being administered, and what a pharmacist should avoid. Basically, it cannot be prescribed with other antidepressants, like I have discussed. According to what we pharmacists are taught, no other medication should be provided more than it's needed. And especially in case of antidepressants or any medication that's affecting our central nervous system, we need to be very careful while prescribing to our patients. So, also in this case, if we are using these tricyclic antidepressants, there is no need to prescribe more than necessary. We cannot prescribe it with other MAOIs or on a person which has been on MAOI therapy as discussed in its contraindications. We will not double dose it if a dose is missed, and we cannot prescribe it in pregnancy, mania, or any people which have cardiovascular disorders or that have congenital heart defects. Now, we will discuss the use of this drug in a clinical case setting that can set an example for us. In this case, study, a 43-year-old male patient has no personal or family history of any mental or neurological illness. His obsessive compulsive symptoms have been being observed since the age of 39, and the patient has recognized his own abnormal behavior, but he cannot change it. The symptoms given include washing of hands and feet ritually, He keeps checking the contents of documents, and he compels his other family members and mates to perform the same conduct as he is. Seeing his symptoms, he is being hospitalized in a nearby medical college, and his Yale Brown Obsessive Compulsive Scale reading is 32. If he goes for a walk, he looks here and there around again and again, and he keeps feeling like he has lost things. He keeps washing his hands, and he spends a lot of time on it. And we have performed other confirmatory conduct tests and observations uh, that serve as an evidence for his other actions. So in this case, what are we going to diagnose, and what exactly are we going to prescribe? We will deal it properly like we deal in the form of a soap note. Moving towards the subjective part of this note, we will now see it. Given the patient's medical history, in this case, the age of this patient is 43 and his gender is male. His chief complaint is obsessive compulsive behaviors and anxious behaviors, as seen by his symptoms of washing hands and feet, of checking his documents, of anxious behaviors on his walk, and etc. etc. The symptoms are mentioned here. The patient does not have any other medical history, but his symptoms have been present for 4 years. The objective part of this SOAP note or the laboratory data we have collected or mentioned is the Y-box score of 32. What exactly is a Y-box score? Y-box score is a standardized rating scale which has a self-report version available in which the therapist or physician asks the patient to answer some questions or some places some items in his reach and give based on his answers. Points are marked, and if the points come on a certain rating scale, they are diagnosed with OCD. In this present circumstance, the score is 32, which is actually very high. So what is the plan? Oh, sorry. Before that, we move on to the assessment. So, what do we assess from all this given data? The patient's symptoms showcase many versions of obsessive behaviors, indicating the presence of OCD. And the patient's desire to compel others to do the same basically showcases behavior that he is confident of the fact that he is doing right, even though he is not. And this confirms the presence of obsessive compulsive disorder. When anything is beyond a given limit, it turns into a severe marker of a disease. And in this case, this person's behaviors are indicative of a disorder. In this way, we can conclude that the patient does have obsessive compulsive disorder, and other than that, his anxious behavior showcases that he also has some form of anxiety that is usually normal coupled with obsessive compulsive behaviors. So the plan hence becomes patient counseling in non-pharmacological management. The patient is in need of therapy to assure him that his behavior is not right, and he needs to cope up with it, and there is not like he shouldn't do all of this stuff, and it's not necessary. It's only in his head, and the treatment is going to help him cover it up. The pharmacological management is the prescription of clomipramine starting from 75 mg per day, along with bromazepam, which is an anti-anxiety medication given in 15 milligram per day in divided doses. In case there is no improvement using this therapy, it is an indication that SRI resistant OCD might be present. So we will increase the dose of clomipramine to 200 milligram per day OD along with risperidone that might be effective in treating this SRI resistant OCD. The dose that will be prescribed will be 1 milligram per day OD. So this is all about my case study and my presentation, in which there was a brief introduction and rational use of clomipramine along with its use in a clinical setting. I hope this presentation educated you on its various outcomes. The references I use include two pharmacology books, and since there was not much material available in pharmacology and pharmacotherapeutics books, I had to take my case from the internet that was showcasing the use of clomipramine in the way I was describing. Thank you.